Welcome back, everyone. I'm Dr. Khan, and I am hyped for today's session. We are diving into the world of cartilage, the body's silent, resilient support system. It's not just filler. It's the difference between a smooth walk in the park and a painful trip to the orthopedic surgeon. If you want to understand how our bodies handle stress, you have to understand these three specialized tissues.
And I'm Dr. Sarah. While Dr. Khan looks at the movement, I'm looking at the microscopic architecture. For your board exams, the examiners love testing your ability to distinguish between these types based on their matrix composition and where they are located. Precision here is the difference between a passing score and a perfect one.
Right on. So let's start with the classic, hyaline cartilage. I like to think of hyaline as the ice on a skating rink. It's smooth, it's bluish-white, and it's everywhere you need low-friction movement. It covers the ends of long bones in those synovial joints we rely on.
Exactly. High-yield point alert. Hyaline cartilage has a high proportion of amorphous matrix. In fact, the fibers inside have the same refractive index as the matrix, which is why it looks so glassy and clear under the microscope. You'll find it in the nose, the larynx, the trachea, and most importantly for the boards, the epiphyseal plates of growing bones.
Why does this matter clinically? Well, look at those epiphyseal plates Sarah mentioned. In kids, that hyaline cartilage is the engine for growth. If a child has rickets, a vitamin D deficiency, that cartilage matrix doesn't mineralize correctly. The plates widen, the bones soften, and you get that classic bowing of the legs because the skating rink isn't strong enough to hold the weight.
And remember, hyaline is also notorious for its poor repair capacity. When it's fractured or worn down, it doesn't grow back as hyaline. The body fills the gap with fibrous tissue, which isn't nearly as smooth. That's essentially the roadmap to osteoarthritis.
Which brings us to our second type, the tough guy of the family, fibrocartilage. If hyaline is ice, fibrocartilage is a heavy-duty rubber tire. It's built for the high-pressure zones.
Precisely. From a board perspective, fibrocartilage is defined by its dense bundles of collagen fibers embedded in a small amount of matrix. It is the only type of cartilage that lacks a perichondrium, which is that fibrous membrane covering other cartilages. You'll find it in midline structures, the intervertebral discs, the symphysis pubis, and the TMJ.
Why does this matter clinically? Think about those intervertebral discs. They are the shock absorbers for your spine. When that fibrocartilage fails or the disc herniates, which we often see on an MRI, it can compress a spinal nerve. Every doctor of choice knows that identifying a herniated disc on imaging starts with understanding that this specific tissue was supposed to be the buffer between those vertebrae. Don't forget the knee, Dr. Khan. The menisci are fibrocartilage wedges. Because they have such a poor blood supply, they don't heal well. A tear in that rubber tire usually requires surgical intervention because the internal repair mechanisms are just too slow. Man, it's all about the blood supply, isn't it? If there's no vessel, there's no quick fix. Now, let's talk about the bendy one, elastic cartilage. This is the gymnast of the group. You can fold it, twist it, and it just pops right back into shape.
Board exams love the E rule for elastic cartilage. It's found in the ear, specifically the auricle and the external auditory meatus, the eustachian tube, and the epiglottis. It looks similar to hyaline, but it's packed with a network of elastic fibers.
Why does this matter clinically? Think about the epiglottis. It's that little trap door that prevents you from choking every time you swallow. It has to be incredibly flexible to snap shut and then immediately spring open so you can breathe again. If it were made of rigid fibrocartilage, we'd be in a lot of trouble every time we took a sip of water.
And just like hyaline, when elastic cartilage is damaged, it typically repairs itself with fibrous tissue rather than original elastic tissue. It loses that snap over time if there is significant trauma. So to recap the clinical why, hyaline is for smooth sliding and bone growth. Think rickets and joint wear. Fibrocartilage is for heavy-duty shock absorption. Think herniated discs and knee injuries. And elastic is for flexible structural integrity. Think the epiglottis keeping your airway clear. Perfect. For the high-yield summary, hyaline has a glassy matrix and is found in joints and growth plates. Fibrocartilage has thick collagen bundles, no perichondrium, and is found in discs and symphyses. Elastic cartilage is loaded with elastic fibers and is found in the E locations, ear and epiglottis. That's it for today's deep dive. Keep those analogies in mind and you'll never mix up your matrix again. We'll catch you in the next session where we tackle the bones that these cartilages support. See you then.